welcome to the Integration Station. I'm your host, Michael, a child and adolescent occupational therapist. And today we're doing it a bit different. I'm actually running solo today. So normally our podcast is a Q&A format, and we have questions that come in from our listeners and ones that we might get from others. And if you do have any questions, we've been getting a few, which is fantastic. Send them through to podcast@otfcgroup.au. That's our email. Otherwise, you can find us on Instagram at otfcgroup. Today, I'll be talking, as I said, by myself. So if you like the sound of my voice, great. If you don't, then listen to our back catalogue of fantastic other episodes. But today I thought I wanted to answer a question that someone posed to me, and I thought, actually, we haven't actually addressed that on the podcast at all. And it was, if you were a parent or someone coming to Australia who didn't know about OT, or you're from another country, or you are living in Australia and your young person is accessing services and they hear about OT, what does OT for children look like in Australia? When I think about OT in Australia, I think about what we do at our space. So OTFC, our organisation, and what we provide. But I know that's one way to provide services within Australia, and that's one way to provide services as an OT. And so I think it's really important that we also provide an opportunity to share about what other services are and what they look like. And that journey for a young person and a family who are looking to access something like OT, what does it actually look like? So as a starting point, OT stands for Occupational Therapy. And for those who listen to the podcast, they know that quite well. However, if you are an OT and you're looking to, say, for example, to study OT, that's a university degree and it's a registered organisation. And within Australia, it's part of the Allied Health Professionals registration as well. So we call that AHPRA, and a lot of allied health professionals and medical professionals are part of that organisational body. So it's a registered degree. It takes often 4+ years, depending on if you go through a master's or if you go through a honours degree. And some people get into research and some people get into the clinical space, such as myself and the OTs that work here at OTFC. So I guess the purpose of Pediatric Occupational Therapy is all about child development. So if we think of child development as it is what we would consider typical, obviously we know that milestones are there to provide guidance, but they aren't the be-all and end-all. Child development and milestones can occur at different ages and stages, and whilst some people experience those milestones later, it doesn't mean they aren't able to do the things that other children can. It might just mean that it's been harder work and they just needed more support to get there. So to support that child development in ways that they need to increase their ability to engage in daily activities and in their lives. Now, that can look like skills such as dressing, learning, socializing, feeding. But one of my biggest goals for any young person is their ability to play and to have fun. And I think when you think of childhood, and for a lot of people, I hope this is their experience, is that childhood has always been something you can remember as being quite fun, something where you're learning and something where you're experiencing things for the first time. And for a lot of the young people we see, and for a lot of OTs, they're obviously seeing people who are struggling to experience those things in the way that they would like, and parents are seeking that support. So developmental support is fundamental, and we see clients with a range of differences. Neurodivergence is far more known now. So we see developmental differences such as autism, we see ADHD, sensory processing difficulties, physical disabilities, and learning difficulties and differences as well. So that's just to name a few, to be honest. There's a whole range of differences that we will see on a regular basis. And as an OT, all we're trying to do is support that young person, that family, to have greater success in achieving what they would like in day-to-day life. So common areas, or I guess a focus at OTs would work in, is fine motor skills. And I think sometimes it is a bit of a misnomer that OTs only work on the upper limb and fine motor skills such as handwriting and drawing and using a scissors and holding a pencil. And yes, that is absolutely something that we do. And for a parent listening to this and they hear that their young person does have difficulty with fine motor skills, then OT is certainly one aspect and probably the first port of call. However, OTs work in a lot of other ways, particularly in our space at OTFC. We work on gross motor skills and understand them as the foundations for development in other higher skills that a child might need. But motor skills, fine or gross motor, sensory integration, again, that's a key approach that we take here. Other skills in self-care, toileting, feeding, hygiene, sleep. And anybody that's a parent like myself knows that without good sleep, that can really impact not just the young person, but the entire family. Play and social skills, emotional regulation and executive functioning. These aren't exclusive to OT and certainly do have crossover to other services such as psychology and even to some degree speech therapy and developmental education. However, OTs do spend a lot of time working on these areas, and more often than not, we will find ways of exploring executive functioning such as planning and memory and problem solving in a novel and play-based manner. And if we think about how children learn, and as I said earlier, what we want is for young people to have fun and to be able to play, and children learn through that play. And if we can find the best ways to be playful in our therapy approach, then as OTs, we get the best out of the young people that we work with. So in Australia, there's a variety of approaches that are tailored to developmental, sensory and functional needs of children. I'm just going to list a few of these approaches, but these are the ones that you might see most commonly either on websites or when you do a bit of research about what an OT is and how they work. I also say that some OTs and some organisations might not put down specifically their approach or what, say, framework they use, but that's certainly a question as a parent or a caregiver that you are more than welcome to ask. And I think it's really important that as OTs, we do draw on a framework. And we've talked about it in previous episodes before, but all OTs have this foundation knowledge of the person, environment, and occupational model. And that derives from a Canadian model that explores the importance of understanding a person and their skills and their abilities, the environment in which they live and they do the task they want to do, and the occupation, which is the task that they're trying to achieve. And when those areas are met quite well, then we have increased occupational performance. When there are challenges in any one of those areas, then that can impact a performance. One of the main assessment tools for the intervention about milestone-based interventions is the Peabody assessments used for birth to 5 years. And with that, there are a range of different tasks and skills that are expected for someone within that age range. And so that's something that is used to help understand where a young person is at comparative to their peers and what would be considered expected at their age. This is often used by a number of OTs as a starting point to help guide where a young person is at and to help build their trajectory. As I said, I'm certainly someone who believes that milestones are a guide, and just that. Yes, they can certainly help give greater clarity to where someone's development is going. However, I'm also really conscious that everybody develops at their own stage. And so developmental milestones can help, but there are certainly other approaches that we can take to support the young person. I think in those therapy spaces, we're often using a play-based approach to help build that person's capacity as well. There are other cognitive approaches. The co-op approach, which is the cognitive orientation to daily occupational performance approach, is very much a task-based problem-solving and strategy approach to work on specific goals. It has been widely adopted in Australia, and lots of people use it to build specific skills and goals. And that co-op approach is designed to be used and worked with the young person to work towards their goals. So they're collaborating in that as well. Cognitive behavioural therapy is also used by OTs, and whilst that's a psychological approach, it's certainly used within OTs in a number of ways they undertake their sessions as well. I think for a lot of young people, we see these cognitive approaches as being quite important in building not only their capacity, but also supporting parents in psychoeducation and allowing them to understand how to best support young people in their lives. There are motor and learning neurodevelopmental approaches, such as in neurodevelopmental treatment or NDT. This has certainly been quite noticeable working with those with brain injuries or cerebral palsy, and is still quite a widely used approach. It certainly targets improvement in living skills, but does so in a motor planning and movement pattern-based approach. The DIR or floor time model is something that has been widely adopted as well and has a very similar sort of play-based approach that we take at OTFC. Whilst it's different, it does promote interaction with following the child's lead and building engagement and communication in that way. It has been quite well researched and used, particularly with children and particularly autistic children. Trauma-informed practice has become far more commonplace, which is really important, I think, because the more we understand the impact of trauma and how pervasive it can be, the more we understand the importance of working through a trauma-informed lens. Whilst this has originally been more utilised for those who've experienced neglect or significant intergenerational trauma, we've seen it more in the neurodivergent population as well, and the impact of trauma from the school environment, from different community settings where there may have been experiences that have impacted a young person and led to things such as autistic burnout, and the impact of therapeutic trauma for young people. And with that in mind, regardless of whatever approach is taken, having a trauma-informed lens is very, very important, as it allows us to understand that this person comes with a set of stories that is beyond their milestones, and that we need to truly understand that person and develop their trust before we can actually start working on any of these areas. There's also assistive technology and environmental modifications, and for a lot of people and young people with physical disabilities, this is often used as a way to support functional engagement. That can be adapted seating, sensory equipment, uses of switches and assistive technology to ensure that there is an ability for them to engage in the things they want to do. And finally, sensory integration therapy, which is the approach that we take here. I'm not going to talk too much about this, but it is widely growing to be one of the most evidence-based practices when working with young people, and particularly with children with autism. And as we talk about often, understanding the sensory foundations and the importance of building effective sensory and motor skills for young people increases their chance of engaging in daily activities to the best of their abilities. So how is that therapy delivered? It varies depending on the approach, but generally there's a number of approaches that can be taken. In our space and in the sensory integration space, it's very clinic-based, and so sometimes those services can also be delivered in schools, preschools, and for those in the high school setting, there are services that can be supported there, and health professionals can come in and support people in that space as well. In the home, and increasingly we've had supports provided through telehealth, whilst this has not always been something that OTs have delivered. I think COVID taught us to be quite agile and have to pivot and use our skills in another way to be able to support young people as best we can. And for those who have done teletherapy as OTs, I think the ability to provide a service such as sensory integration therapy through teletherapy is also now more evidence-based. Another way therapy is delivered is obviously in the community. Now, I briefly mentioned in the homes, but sometimes OTs will engage not just in the home, but also in the community spaces. And at OTFC, that's something that we have started ourselves, but it's a very, very common practice for a lot of OTs to be based in the community, go out to spaces, go out to schools and preschools, which I mentioned, but also go out to community spaces, whether it's shopping centres, whether it's community centres, whether it is just a park or a playground, and access the community with that young person to build their skills out in the real world, as we would say. And for those that are clinic-based, whilst they can't always access that, they certainly provide the skills to the parents to be able to ensure that they can continue to work on their development out in the community. Any of these approaches will provide that young person and that family a service that will help them understand the strengths and the differences of that young person, and also give them the confidence that with the approach that they're taking through whatever lens that is being delivered is going to increase the ability for that young person to do the things they want to do, and to increase the confidence of those caregivers to support that young person in their life. Obviously, therapy comes at a cost, and for people who are wanting to access occupational therapy, there are a number of ways to do that. One of the benefits of OT, and the case for a number of allied health services, is that you don't need a specific referral from a pediatrician or a GP to be able to access the service. You can self-refer, and I think sometimes we get some really strong referrals from family members who have seen that maybe something is challenging for a young person and have just self-referred. And sometimes that can be quite validating to see that what they've noticed is also being backed up by a health professional. Of course, therapy does cost, and so there are ways to access supports through funding models. And within Australia, there are a number of methods. And I think this is where Australia is very fortunate that we do have these systems in place to support the young people to access the services that they do need. Obviously, the NDIS is a significant disability insurance scheme to support young people with developmental delay and disability. There is an early intervention scheme that for some they are eligible for, and there is quite a, to be honest, complex and lengthy process to apply for that. However, it is still the most effective method for a young person to be able to access the supports that they do need. The other funding scheme is Medicare, and that's a government-based funding support, which is similar to those in the UK who might know the NHS. In Australia, we have Medicare, which is across the lifespan, but specifically for young people and for children, they can access different Medicare plans when referred via GP. So in this case, a family would need to seek out a GP to provide different Medicare plans. Two common ones are the chronic disease management plan or the mental health care plans. And for those OTs that are mental health endorsed, and we have OTs at OTFC that are mental health endorsed, they can access Medicare plans through the mental health care plan system. Obviously, that doesn't cover costs completely, but it certainly provides a subsidy and provides some financial assistance for accessing services. Otherwise, those who do have private health insurance can access OT through their private health, provided that that is part of their private health plan, and there are some subsidies that come from that. Outside of this, there is a public system, and in Australia, we do have the hospital system and we do have public services that do provide supports. We have GP super clinics that do provide supports there, particularly at an early intervention stage. And these are an important first part. We also have services such as CAFs, which provide for a lot of young children nurses and supports to be able to identify potential developmental challenges that may be occurring. And these can almost be a screen to access further supports. So that gives a bit of a roundup of supports. But I guess the main question comes down to, if you're a family with a young person looking to access OT, what would a session look like? What can I expect to see? Obviously, those who know TFC, we have a lot of information on our socials, and our therapy is very much what you see gives you the best indication of what therapy looks like. But for those other services, it's important to note that the best way to explain OT is to understand that we are quite a holistic approach, and that we are always going to try and work with a family-centered lens to support the young person, the family, to achieve their goals in order for them to be able to access the services that they want to, and generally to be able to have a more fulfilling life through the supports that have been provided. So in terms of what an OT session can look like, it does look very different. And I think this is where OT is quite unique, in that we can have sessions that do look tabletop based if we're working on specific skills. We can have sessions that have a variety of obstacle courses and sensory motor activities and equipment to support development. It can be analysing and addressing someone's functional skills and supporting them to dress or to feed. And it can certainly look like supporting their emotional regulation using social stories and play-based therapy to support how they manage different social dynamics in their day. And finally, I think the most important part is that parent education and having a consult with a parent. It could be a phone call, it could be a phone call with a school or with another therapist, just to provide a greater insight into how that young person is going and really advocating for that young person in all their spaces. And I think at the end of it, OTs are really strong advocates for their clients and for the young people that they work with, because as we know, young people can't always do that themselves. And whilst some parents try their hardest to do that, that is also a hard task. And so as OTs, it is really important that we spend a lot of our time understanding the young people that we work with and advocating for their needs to ensure they have the best chance of achieving the goals they want. So we talked a lot about OT and what OT looks like in Australia. And I think it's very clear that OT aims to be a very holistic service. It is registered quick summary. Okay, I've talked a lot about OT and what OT looks like in Australia, and I'm sure people have a lot of questions still. But I hope from this you get a bit of an idea of the different spaces OT can work, the different frameworks, the different funding models, and just that OT as a therapeutic approach is a very holistic approach and is aimed to support the young person, the family, in a family-centered way to ensure that they have the best chance of reaching the goals and doing the things they want to do in their life. That's all for today. Thank you for being with me on this journey today, and I hope you got a lot of information about what OT looks like in Australia. If you have any questions, please send them through to podcast@otfcgroup.au or via Instagram at OTFC Group. We get a lot of emails. We're reading them. We have a backlog. So please send them through. Next week when Eleanor's back, I will make sure that we will go through as many of those as we can. So thank you again for listening. And one last little shout out to Fletch. Hope you're doing well, mate, and hope you enjoy this episode as well. Thank you.